Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Good morning. We're back in the studio at Be Kind Pediatrics here in the office today. And we've had quite a few patients in the last few weeks ask us about migraines. So I decided today we're going to talk a little bit about what migraines are, what's kind of the basic therapeutic options out there, signs and symptoms that would be concerning to me as a physician, and things that you should definitely mention to your doc. So the first question I usually get from patients and parents are, how do I know if I have migraines or if I just have headaches? So typically, migraines follow a pattern, especially in children, and that is most people know that they are going to get a migraine. They either have some sort of sensory or light sensitivity or sound sensitivity. Some people get nauseous. And that can last a couple minutes up to an hour of this kind of feeling that something funny is happening to them. And then they start getting a headache or head pain. And that pain usually starts kind of gradual and builds over the course of a few hours. And then it can last anywhere from a day to 2 or 3 days. So the next kind of question I usually ask my patients is, do you sometimes get an aura? And a lot of patients and parents are not sure what an aura actually is. So an aura are either changes in your vision, numbness or tingling, and or changes in your speech that you can get before migraine. It's important that these changes are all reversible, meaning they stop and don't persist, and they shouldn't last more than 60 seconds. So these can be things like spots or zigzags in your vision, again, numbness and tingling in your hand, or changes in your speech. Usually blurry vision is not actually considered an aura, but it's important to know because it dictates what kind of management we might use, and it also can be a risk factor for stroke later on in life. And so it's an important thing to be aware of and to mention to your pediatrician. Another frequently asked question I've been getting about migraines and headaches is there an area where you're getting a migraine and headache that is more concerning than other areas? So this might, in the past, physicians used to think if you got a migraine in the back of your head called an occipital migraine, that was of concern. But actually, the latest research shows that occipital migraines are not as concerning. Areas that are concerning is if you're getting a migraine constantly on one side, so always on the left or always on the right. Typically, migraines can be one-sided, but they move around. So one time it might be on the left, the next time it might be on the right. And that is more typical. But if you have what's called a side-locked migraine, meaning the migraine is consistently on one side of your head, that is concerning and something you want to bring up to your physician right away. So I think migraines in general are very concerning for parents. The number one question, I feel like the aching question in the back of everyone's mind are, when should I really be concerned that this is more than a migraine or a headache? So for me, some signs and symptoms that would make me send a patient to, let's say, the emergency room right away would be if there's change in your child's mental status, meaning they're confused, they're not acting themselves, they're speaking nonsensically, they are very lethargic, and in medicine, lethargic means truly difficult to wake up. So any change in their normal mental status would be very concerning to me. Another concerning sign and symptom that I always ask about is there any recent history of head trauma? So if you had a child who, let's say a small baby who recently fell from the bed, that would certainly be concerning. Any recent within the last day or so, really head trauma I would want to know about. Usually the further out you are from the trauma, the less risk that there is concern. And so when the head trauma occurred is important. Was it recent, like today, or was it a week ago? If it happened a week ago, that's less concerning than if it happened today. Other, really concerning signs and symptoms that would make me send a patient to the emergency room straight away is if they had a seizure associated with the headache, especially if they don't typically have seizures. If they have any weakness or numbness in their body that is persisting, or if the headache is something called a thunderclap headache. So that means that the onset was abrupt. So in the beginning, we were talking about how typically migraines follow a pattern where they start low and they build up over time. But a migraine that goes from 0 to 10 in intensity straight away within minutes is very concerning. And that patient would be one that I would say you should probably go right to the emergency room. Another natural concern I get from parents are, what if the migraine is waking my child from sleep? And so for me, the real question there is, how often is it waking you up from sleep? If your migraines are waking you up more often than not, yes, that is very concerning to me. But if your migraine wakes you up once or twice a month, that's a little bit less concerning for me. However, usually if a migraine is waking a child from sleep, I will recommend that they see a neurologist and that we get some outpatient imaging of the brain. Usually when we're getting imaging of the brain for patients, the best image is an MRI. And so that is something usually I'll start working on scheduling while we get you in to see a neurologist. And so I think the next natural question is kind of, are there other reasons that I would maybe recommend for a child to get an MRI of their brain associated with migraines? And there are a few. So outside of frequent nocturnal awakenings, another reason might be if the headache is positional. So what that means is if your headache is worse when you're lying down, or if your headache is worse when you're standing up straight. Worse when you're lying down can be a sign of increased intracranial pressure, and worse when you're standing up straight can mean something like a CSF leak. And so that would be another reason for me to get an image of your child's brain to look for any malformations. A few other reasons might be like when we talked about in the beginning, it would be atypical for migraine to be what we called side locked, meaning that it's always happening on one side of your head. So that would be another reason. If your child is very young, less than 6 years of age, it's an atypical age for migraines. And so that might be another reason to get a picture of the brain. Another reason would be if your headaches started off like you were having them once or twice a month, and then they rapidly progressed to having them every single day. So that rapid progression or a change in pattern to them becoming more frequent would be concerning. And I might recommend a picture of the brain at that point. And then lastly, to kind of go along with the positional migraines is something called worsening with Valsalva, meaning if you sneeze or you bear down or anything that increases your intrathoracic pressure, like coughing and sneezing, using the restroom. If your migraine is worse with any of those, I also would maybe recommend an image of your brain. The next thing I think to kind of naturally talk about is how do you treat migraines that are kind of run-of-the-mill, there's no red flags and no concerns. So the first thing is really identifying migraine triggers, and that's very individualized on patient needs. So usually I ask them to fill out a migraine diary for a couple weeks, helping me identify some of those triggers. Common triggers are things like overheating, exercise, weather, hydration status, sleep status, as well as stress. I would say stress, sleep, and hydration being probably the three most common. So once you identify a trigger for your migraine, you really want to avoid that trigger as much as possible. All patients with migraines should try to ensure that they have adequate hydration, adequate sleep, and adequate nutrition. So we know that being underhydrated, being very stressed out, having irregular sleep, meaning you go to bed at 1 o'clock, some nights you go to bed at 10 o'clock, these can all make migraines much worse, and they can also help your migraines. So if you consistently have a consistent bedtime, you're consistently getting adequate amount of sleep, you're consistently meeting your hydration goals, and you're eating a well-balanced, healthy diet, these things will all help your migraines greatly. So the next thing to talk about after we've optimized sleep, nutrition, hydration are going to be pharmacologic interventions like Motrin, ibuprofen, Excedrin, or triptans. The place that I usually start is with ibuprofen or Motrin, and you want to use the maximum dose here, so 10 milligrams per kilogram. You want to take your ibuprofen at the onset of your migraine, so really ideally within 30 minutes that you're starting to feel that you have a headache, no more than 60 minutes from when you start to notice the symptoms of your migraine. The earlier you take it, the better it works. Another thing to kind of be aware of, and I would talk with patients about this, is you can get rebound migraines from using both ibuprofen and triptans. So you want to make sure you're not using this medication more than 2 days a week or more than 10 days a month. If you are needing Motrin, Excedrin, and or your triptan that often, you need to bring that up with your doctor. So with triptans, you really want to start using those for only severe migraines, and you usually start with a low dose because the side effects are usually dose dependent, so you want to use the smallest amount of dose possible to reach therapeutic effect. So besides Motrin and triptans, there are other therapeutic options. Some of them being the nutraceuticals. Those are coenzyme Q and riboflavin. These are a really nice therapy, and I recommend starting them in all patients who have migraines. Which one I use depends a little bit on the patient. So for patients, particularly those with dietary restrictions, like let's say a patient who is vegan or vegetarian or just doesn't eat that much meat, I might recommend starting with coenzyme Q. For patients who are dairy-free, then I might start with riboflavin. But in either event, as soon as I find a patient who has bad migraines, I usually recommend starting one of the two. There's pretty good evidence that they reduce symptoms of migraines, and they have very few side effects. And so this is a really nice medication that you can help, that you could potentially talk about with your doctor for starting early on in your migraine management. There are other therapies, like for patients who particularly get occipital migraines, we now use occipital Botox. And then there are additional medications that are recommended when patients have such bad migraines that are lasting more than 72 hours, that are really interrupting their ability to go to school or to function every day. At that point, I really recommend that you see a neurologist, but there are additional therapeutic options for patients who are not able to achieve significant symptom relief or who have such bad symptoms that they need those right off the bat. Usually, most of these medications, or really any therapeutic option that you're going to start with migraines, we're looking for a 50% reduction in symptoms. And most therapies, if not all, are going to take at least 8 weeks to start working and up to 2 to 3 months before you really say that that medication is failing. So you really need to give each of these therapeutic options a good chance to succeed before you switch. And I mentioned that right off the bat because I think it's important to set those expectations up front so that you don't feel like your child is failing at therapy when potentially they just haven't had the chance to work yet. And so I just want to close out by saying migraines affect a lot of people and they can be severely debilitating for those who have them. So I encourage you all to reach out to your physicians if you have any questions or you think you're experiencing migraines. There's always research being done in this area of medicine. It's ever evolving. And so there are new therapeutic options kind of cropping up every day. There's lots of different information out there on the internet. And so if you have a question, I encourage you to leave a comment below or ask your physician. And so I hope this video was really helpful to anybody who's experiencing migraines or to anyone who has a child with migraines. And I hope it helps answer some of the questions about things that you should be concerned about, maybe things that you thought you should be concerned about but are less concerning after listening to this. And I encourage you, if you have any questions, to leave a comment or to reach out to your physician.
Thank you for watching The Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.